Either you can get on board with AI now or you can get on board with it later. Either way, you're going to need to get on board with it. Why are nurses not talking about ChatGPT when every other industry is? Let's talk about why it's important for us to start bringing AI, specifically ChatGPT, into our nursing conversations. If you're new here, hi, my name is Jeanette. I'm a nurse turned family nurse practitioner. Prior to becoming a nurse practitioner, I worked as a bedside nurse for 8 years, and I've been a nurse practitioner for 4. On this platform, I make content about nursing to help you succeed in your nursing journey and also to help you find work-life balance. So I've been in the nursing field for almost 20 years, and I've been using social media for, since it started. And one thing I've noticed is that nurses are not talking about using ChatGPT at all, or they're using it and just not openly talking about it. It's almost like there is this unspoken barrier. Like we should be staying away from the technology that's already revolutionizing other industries and the world. As a family nurse practitioner, I spent the first couple years of my practice buried in charting, administrative tasks, and feeling very burnt out. And then in 2022, ChatGPT came out. I found out I could use it in practice to help me streamline my work, and then everything changed. So we know I'm not the only one using ChatGPT in nursing and outside of nursing. But why are we not talking about it? Now, I know what you might be thinking. We're burnt out, we're tired, we're short-staffed. Isn't AI just another thing to add to the list of million things that we have to keep up with? Or maybe you are wondering, how can something like ChatGPT help me in my daily nursing practice? Well, let me tell you, it's a game changer. ChatGPT is not just some gimmick. It's a tool that can transform how we work and how we reduce stress. But we need to stop acting like it's a secret and start using it to our own advantage. Let me break down why we need to talk about it and, most importantly, use it. First thing first, time is money. And in nursing, time is everything. Between patient care, administrative work, meetings, continuous education, it's easy to feel like there just isn't enough time in a day. This is where ChatGPT comes in. Let's say you have a full schedule. You're super busy and are behind on charting. ChatGPT can help generate clinical notes that will take a fraction of the time that it will take for you to write it yourself. You know the dreading emails from admin that you have to reply to? Guess what? ChatGPT can help you write them. The patient communication, ChatGPT can help you draft those. Do you know how much time we spend trying to think about the right words to say to administration, patients, pharmacy, family members, and everyone else that we have to answer to? A lot. And guess what? ChatGPT can help you draft these emails in a matter of seconds. That's time saved that you could be spending with your patients and better yet, at home with your family. But it's not just about saving time. Let's talk about something that is very real in the nursing world right now: burnout. Burnout, as we know it, is very real, and it's one of the biggest problems in nursing right now. Long, busy shifts, never-ending to-do lists, and the constant need to meet the expectations of our patients and administration can leave you feeling pretty drained. When I started using ChatGPT, it felt like weight was lifted off my shoulders. To save yourself and prevent burnout, this is what you can do. You can offload repetitive tasks to ChatGPT, like drafting emails and filling out forms, FMLA forms, short-term disabilities, medical excuses, doctor's notes. All these are things that you should not be doing yourself. Now with ChatGPT around, all I'm saying is I no longer stare at a computer for 20 minutes trying to draft the perfect note to send to administration, patients, their employers, insurance, and you should not either. Now, maybe you're thinking, I work in a small clinic. This tech stuff and ChatGPT stuff, it just isn't for me. You're wrong. You probably need ChatGPT more than the people working for big organizations. As a nurse practitioner, I've worked for small private clinics, and I've also worked for big clinics that are owned by big healthcare organizations. I've seen a lot. What I know for sure is that the small clinics usually don't invest money in technology. They buy the most basic EHR systems they can find, and sometimes don't even upgrade it or update it for years. The big clinics, they have the sophisticated stuff. They invest in technology and innovation. They have their own ChatGPTs built into their systems. So you, working for a small clinic, need ChatGPT more than those that are working for big organizations. ChatGPT is free and accessible from your phone and your computer. You don't need your small clinic to pay for in order to use it. With that said, whether you're working for a big organization or a small clinic, ChatGPT can help ease your workload. I think it's time that we stop pretending that ChatGPT and other AI models are not part of our lives now. Heck, They're part of our future. Nurses have been using AI for decades. We are the OGs of AI. ChatGPT is not going to be the first or the last. So we shouldn't be ashamed or afraid to admit that we're using it in our everyday practice. AI is here and it's here to stay. It's either you get on board now or get on board later. But at the end of the day, you're gonna need to get on board with AI. So what have we learned today? ChatGPT is a tool that is meant to make our lives easier, not more complicated. It saves us time, reduces burnout, and most importantly, it is accessible to nurses everywhere, no matter where you work. If you're ready to make your work easier, try using ChatGPT and see how it can change your day-to-day. If you've been using ChatGPT in your nursing practice, share your experience in the comments. Let's start a conversation about this. There are so many people out there who are interested in using it, but they just don't know enough about it to trust it. The more we talk about it and learn how to use it responsibly, the more nurses will start talking about it as well and using it in their practices. If you haven't already, please like this video, comment down below, subscribe to my channel, and share this video with other nurses who may be interested in this kind of topics. Thank you for watching this video till the end, and I'll see you in the next video.